Welcome to our series on antibiotics. In this first episode, we are exploring the basics what antibiotics are, the different types, how they work, and what they are used for. Understanding these fundamentals is essential. Antibiotics are medications designed to fight infection caused by bacteria. They either kill bacteria, which is known as bactericidal, or slow their growth, which is known as bacteriostatic, making it easier for our immune systems to fight off the infection. However, antibiotics are specific to bacterial infections. They don't work on viruses like the flu or the common cold. There are several types of antibiotics, each with a specific function and target. First, we have beta lactams, which include penicillin and cephalosporins. These are among the most common antibiotics often used to treat infections like strep throat, pneumonia, and urinary tract infections. They work by disrupting the bacterial cell walls, causing the bacteria to burst and die. Next are macrolides like erythromycin and azithromycin. Macrolides target the bacterial ribosome, the protein factory of the cell, which stops bacteria from making the proteins they need to survive. They are commonly used for respiratory infections and skin infections. Fluoroquinolones, like ciprofloxacin, are powerful antibiotics that target bacterial DNA replication. They are used for serious infections, including certain respiratory and urinary tract infections. However, due to side effects, they are generally reserved for cases where other antibiotics are not effective. Then we have tetracyclines like deoxycycline. These antibiotics inhibit protein synthesis in bacteria, making them effective against a wide range of infections, including acne, respiratory infection, and Lyme disease. Lastly, aminoglycosides, such as streptomycin, are often used in hospital settings to treat serious resistant infections. They interfere with protein synthesis but tend to have more toxicity, so they are carefully monitored. Antibiotics work by targeting specific parts of bacterial cells that human cells don't have. This is what makes them selective and generally safe for humans to use. Each antibiotic type has a unique mechanism. Some antibiotics attack the bacterial cell wall like beta lactams. Others interfere with protein synthesis like macrolides and tetracyclines. Some, like fluoroquinolones, target DNA replication. By understanding how these mechanisms work, doctor can select the right antibiotic for each type of infection. Now let's look at some common uses. Antibiotics can treat a wide range of bacterial infections from mild to severe. Here are a few examples. Respiratory infections like pneumonia or bronchitis. Urinary tract infections caused by bacteria called Escherichia coli. Skin infections such as cellulitis or infected wounds. Gastrointestinal infections like certain types of food poisoning. Antibiotics are powerful tools for fighting this infection, but they are also highly specific. That's why it's essential to use the right antibiotic for each bacterial type and to complete the prescribed dose. Antibiotics has been life-saving, but their misuse had led to a serious problem, antibiotic resistance. Bacteria can evolve and develop ways to survive even the strongest drugs, making some infections harder to treat. Antibiotic resistance happens when antibiotics are overused or used incorrectly. That's why it's crucial to only take antibiotics when prescribed by a healthcare provider and to follow the entire treatment course. Thank you for joining me in this introduction to antibiotics. In the next episode, we will explore specific topics like antibiotic resistance, side effects, and latest developments in antibiotic research. Understanding these fundamentals is our first step in staying safe and informed about these powerful medications. Stay tuned for episode 2 Antibiotic Resistance Causes, Impact, and What We Can Do. Thank you. Kindly subscribe to my channel. Thank you. Bye.